California HOSA. I'm Stacey Nguyen, your Region 4 Vice President. Thank you for joining us. We are excited to launch our new healthcare professional highlight interviews. Throughout this year, the state officer team will be interviewing different people throughout the healthcare industry to highlight their profession. Let's begin with orthopedic surgeon, Dr. Perry Secor. Dr. Secor attended UC Davis for his undergraduate schooling. He received a Bachelor of Science in Electrical Engineering. From there, he was accepted into UCLA Medical School and went on to complete his residency there at UCLA, as well as his surgical internship. An ortho surgeon since 2001, he currently practices at Los Alamitos Orthopedics. Now let's join our state president, Ishan Nagpal, and our Region 5 Vice President, Audrey Mayores, as they chat with Dr. Secor.
Hello, everyone. Thank you for joining us today for our interview with Dr. Secor. Let's begin. Why did you choose to specialize in orthopedics?
Well, I was an electrical engineer before I went to medicine, and orthopedic surgery is very mechanical. It's very engineering oriented. It's very concrete. You see a problem, you're able to fix it. So I was attracted to that.
How much additional schooling is involved with becoming an orthopedic surgeon?
Most programs require you to graduate from college. Some of them are combined programs, but most of them require 4 years of undergraduate work. And then after that, you go to medical school, which is typically another 4 years. And then after that, there's an orthopedic residency, which is usually 6 years. And then there's usually a specialty after that, which is 1 to 2 year program. So if my math is right, that would be 4 and 4 and 6 and 1, which if my numbers are right, is 15 years.
I am curious, why did you change from engineering to medicine?
I'm an odd bird. The things I usually go to things that I don't understand, and that's what I want to do. When I was in high school, my dad was an engineer, and I didn't understand what he did, so I went to engineering school. Anyway, our family, there aren't very many doctors, and so I just didn't understand medicine. And people are a little bit intimidated by it. Very logical, smart people, when it comes to medical things, frequently don't really want to understand. They just, the sight of blood just scares them, I think. In any event, so I was just curious. They let me into medical school, and luckily they let me into orthopedic training.
What type of orthopedic surgery is your favorite to perform and why?
It's a dream of the gods to take the crippled and allow them to walk. And so when you do joint replacement, you're able to participate in that. Most people, before they need a knee or a hip replacement, can't walk. And the ability to change their lives in such a wonderful way and to participate in making literally the crippled walk is really a joy to do. And so I really enjoy technically doing the surgery. We're now using computers to help us make sure that our components are placed appropriately. And then also just participating in the care of the patients and watching them be able to regain a function that they've lost. It's really it's a privilege and a joy.
What advice would you give a student who is considering becoming a physician in general or specifically an ortho doctor?
I think what you need to do is follow your dreams. If no matter the obstacles to getting to a medical career can be very high, you have to get through, well, there's educational ones you have to qualify. There's financial ones you got to figure out how to pay for it, all those things. But I think the first thing you do is you just look past all the obstacles and just follow your dreams. And if you do that, you will overcome all the obstacles. And I think that's true of not just not just medicine or orthopedics in particular, but of any profession. So I think that's the first thing to think about. And then I would encourage you the people to go and try different activities in medicine, such as volunteering at the hospital, getting into a phlebotomy program. That's where you draw blood, so you get contact with patients and you feel comfortable working with people. Those kind of things to make sure you really want to do that. I have several people in medical school that got halfway through medical school and decided it really wasn't the right career for them. So I would encourage people to go try things that are in that line of the profession before they really commit themselves to it. Although most people, they really do know what they want to do. And again, I would have people follow their dreams.
So one more question. How many surgeries do you think you've performed over the course of your career?
It's over 25,000. So I happen to be a workaholic. So typically, I'm old now, but when I was younger, we used to do 20 a week. Now I run a large medical group and I'm down to about 10 a week, but been doing it for about over, 37 years. So it's a long time. And you add all that up, it's at about someplace between 800 and 1,200 a year. So about over 25,000.
Quite the accomplishment.
Well, I've just been privileged to be able to do this. It's, for me, if you can make your vocation your avocation, in other words, what you like to do the most, your work, it's really a fortunate position to be in. And I think that as a motivation for students who want to go into medicine, most doctors can achieve that goal. It's a real joy, again, a privilege to be able to take care of people.
Thank you, Dr. Secor, for your time and insightful answers. Hello, Cal-HOSA, your State Vice President, Vikram Chatterjee here. I'd like to introduce you to gastrointestinal specialist, Dr. Arnav Biswas. Dr. Biswas attended UCLA for his undergraduate schooling. He received a Bachelor of Science in Biochemistry. From there, he was accepted into Des Moines University College of Osteopathic Medicine and Surgery for medical school. After medical school, he completed an internship and residency through Pennsylvania State University. Lastly, he completed his fellowship in gastroenterology and hepatology at Pennsylvania's Hershey Medical Center. Currently, he's the owner and head physician of the Gastro Group Incorporated in Victorville, California. Now, let's join our State Secretary Hannah Zia and our State Parliamentarian Prishna Martinez as they interview Dr. Biswas.
Hello, and thank you for joining us. We are excited to be interviewing Dr. Biswas today. So let's get started.
All right, Dr. Biswas, what made you interested in practicing medicine and specializing in gastroenterology?
Excellent question. Medicine was never really on my mind when I was younger, but I knew I wanted to do something in the life sciences. I grew up, my mom was a physician, so I kind of saw a little bit what private practice medicine was all about, and that's not something I wanted when I was younger because it was just very hectic, very busy. But as I got older, I kind of realized that I was still sort of drawn to the life sciences. I majored in biochemistry when I went to college, and eventually found my path to medicine after a couple of detours. But gastroenterology is one of those things where I think it clicked for me as soon as I started. It's very procedural. I love procedures. But at the same time, I really enjoy patient interaction. I have long-standing patient relationships, which I value a lot. So gastroenterology is a nice mix of both. It's not 100. It's as close to 50-50 as you're going to get in the world of medicine. It's not nearly as time-intensive as, say, surgery is when they're always in the OR. But it's a very fun specialty. And actually, on my path to my career, most of the people who are gastroenterologists were always in really good moods. They're always smiling. They're always happy. And I thought, I want to be one of those guys. So that's the path I chose, and I haven't looked back. I've had a really good experience so far.
So, you had mentioned your family earlier and how your family had kind of inspired you to go towards this path of medicine. So my question to you would be, how do you balance your current medical profession with your family and your personal life?
It is, you have to separate or make some time to separate your career and your personal life. Medicine, as you guys know, because I'm, obviously with HOSA, you're very dedicated to promoting the health sciences. It is a very time-consuming career path, particularly private practice. I'm sure all aspects of medicine are time-consuming, especially getting to the point where you are establishing your career. But in a private practice lifestyle, you're kind of the master of your own realm, and so you have to find a way to separate work from family. And as I've gotten more mature in my career, I've tried to dedicate a little more time to family. Work is always there. but you really have to make time for your family and the things that, and those that will support you and will be there for you. So I try my best to do as close to 50-50 as possible. You know. So my family has been very supportive. My wife, my kids, they know when I'm at work, I'm at work, but when I'm home, you know. So it's important to really relish the time that you have with your loved ones, and because you know once you're at work, you know I'm pretty much at work. I don't think about too many other things besides work.
So earlier you talked about doing procedures. So what is the hardest GI procedure, and why is it the hardest GI procedure?
So there's a lot of procedures in GI that I'm sure many of you are familiar with. The more common ones that people know about are diagnostic colonoscopies for colorectal cancer. We do these procedures called upper endoscopies or esophagogastroduodenoscopies. But GI has really been on the border between full-blown surgery and basic GI procedures. And the ones I'm referring to are the ones that are called they're almost minimally invasive procedures. The ones that I love the most are, my favorite are called ERCPs. ERCPs in the world of GI, it stands for endoscopic retrograde cholangiopancreatography. We just call them ERCPs for short because they're just a lot easier. Basically, it's an evaluation of the bile duct, and the bile duct is the part of the human body that connects your small intestine to your liver. Those GI procedures are they're very detail oriented. It involves very small endoscopes, and that's what I enjoy the most. That's the part of gastroenterology that really attracted me the most. There are several other GI procedures like endoscopic ultrasound that allow you to do some crazy procedures short of surgery. You know, so the advantage to the patient is you're doing all these really cool procedures, and the patient wakes up, no incisions on their body. They're pretty much in an hour, 45 minutes, they go right back to doing what they want. That is the beauty of GI, you know, as opposed to general surgery where oftentimes there's a recovery period. Gastroenterology, there is barely a little to no recovery period involved. And I think that makes it more appealing to patients, especially when they seek out treatment. And that's what I enjoy doing.
So you had talked about how, you know, patients are like the focus, and how the patients, you just feel that joy and that happiness when a patient can walk out of there and like get back to what they were doing and celebrating and continuing to live their lives 40 minutes after a procedure. So I'm actually kind of curious. Patients come in and they must be some type of preventable GI diseases, correct? And like, how can they be avoided?
That's a very good question, Prishna. So the hallmark procedure in gastroenterology, the ones that you will hear probably most, or all gastroenterologists that practice clinical medicine, is the screening colonoscopy. So on the list of diseases or ailments of mankind that are preventable, there's a lot that are preventable and there's a lot that aren't, unfortunately. But in GI, the one that is clearly preventable based on medical science is colorectal cancer, right? So colorectal cancer is the second leading cause of cancer death in both men and women behind lung cancer. But the difference between colorectal cancer and lung cancer is that colorectal cancer has a screening tool, which is the colonoscopy. You know, right now the current recommended guidelines are anyone over the age of 50 and all African Americans starting at the age of 45 should have a routine baseline colonoscopy. But the main purpose of the procedure is to find these precancerous lesions called colon polyps. And if we remove them, we know for a fact that they have been shown to eliminate or reduce a person's lifetime risk of colorectal cancer. So when people come into the office, you know, obviously most people are very apprehensive. You know, they are apprehensive about the actual procedure itself because it can be uncomfortable. The prep is uncomfortable, but after 15, 20 minutes, if you can figure out and someone can eliminate your potential lifetime risk or 5 or 10 year risk of developing colorectal cancer, I would say that's a procedure I would do every single time. You know, it's not a procedure that the physicians have to really sell. This is just like a mammogram. It's a health maintenance procedure. It's something that is absolutely critical. And unfortunately, you know, in 2020, what we're noticing now is that the pattern of younger people developing colorectal cancer is slowly moving down to people in their 40s and 50s, where maybe when I started 10, 11 years ago, it was people in their 50s and 60s and 70s and 80s. But now we're seeing the younger population, getting ailments that like colorectal cancer that people you typically associate with the older population. So to be able to do a screening procedure that's preventative, that's diagnostic, that's therapeutic, that is very gratifying. Yeah.
So you had talked earlier that you do lots of minimally invasive procedures, including colonoscopies in which you actually have to look through a scope. So I assume you're good at video games because you're doing all these procedures with just, small instruments and very fine, delicate movements.
If I had more time, I actually would play more video games because it's probably one of those things I probably enjoy, but my wife does let me, and my kids take all my my PS4 time away from me. But some ambidexterity is good. I mean, you want to be able to have some sort of mechanical skill. You learn your trade as you go along. You're definitely you're never good at something on day one. But I think I've probably done at least maybe 80, 90,000 colonoscopies by now. And so over the course of, the last 9 years that I've been in practice, I can probably do one, not with my eyes closed. I would never do that, but I'm pretty close. You do need to have some mechanical skill, but anybody who's interested in a career, whether it's gastroenterology or general surgery, you will learn the trade and you will become good at it only by repetition.
So one more final question. What are the most rewarding parts of your career, and what are also the most difficult, the most hardest parts?
Good question. It's tough. It's tough to answer. The most rewarding part of my career is definitely taking care of my patients, seeing them get better. A lot of times, the relationship that we build with your patients, oftentimes it's 5, 10, 15, 20 years in the making. I've had patients now for 9, 10 years, and I've known them like I've known them, my whole life. And they kind of depend on you, and you truly want to help them because you have almost a duty and almost you feel like it's your responsibility to take care of them and their families, especially when they come to you or when they reach out to you. So I do like. I love the long-standing relationship that medicine has afforded me. The rewarding parts of my career, besides patient contact, is the camaraderie that I have with my colleagues. I have a group practice, and so I do enjoy, kind of sharing tough cases with my associates, and we kind of, do like a brain powwow and try to figure out what's best for our patients. That is probably the most gratifying part. For me, even though I'm in private practice, I'm still in very much of a team environment, and I really enjoyed that. Hardest part was getting here. The hardest part was definitely getting here. Choosing a career is always tough, and I would say that take your time. You guys are young, you're extremely intelligent. I'm sure your audience at HOSA is very bright, but take your time, make your choices. Look at the entire field as a whole, and take your time to make your decision. It took I think 15 years after high school to get to the end of when I started gastroenterology. So it's a long career, it's a long pathway. The only advice I tell people who want to do something similar is keep your head down, keep at it, and definitely do not count the number of years that's going to take to get here. Just put your head down, bulldoze through it. You'll be just fine.
Thank you so much, Dr. Biswas. I learned so much, and I'm sure that in our midst we have lots of future GI doctors. I really thank your time and just thank you for taking time out of your busy schedule to come and talk to us. I really appreciate it, and we all do.
Thanks for having me. You're most welcome.
Thank you, Dr. Secor and Dr. Biswas, for taking the time to speak with us. The healthcare industry is dynamic and diverse, with hundreds of careers to explore. This interview you just watched is the launch of the State Officer Team's monthly YouTube series, Spilling the Tea with Health Professionals. Be sure to subscribe to our YouTube channel, Cal-HOSA Headquarters, so you don't miss out. And that's the tea for now. See you next month.